first I would like to ask for your permission to use this video for educational purpose and on internet.
Absolutely.
Thank you. Now, your surgery was about a year ago, is that
Yeah,
correct?
it was October 4th, 2016.
So, and tell me about your symptoms before the surgery.
Well, it would, mostly when I woke up in the morning, it would take me a couple hours to get my left leg so it wouldn't bother me. And it would occasionally be all right most of the day, but every once in a while I'd have the pain in the left leg, and it would go down almost to my ankles.
And how bad was that pain?
I would say, 8 to 10 in that range.
And then after we did everything else, we looked at your pictures, we put you through our protocols, and we did the surgery. How was the pain in the leg after the surgery?
Totally gone.
How long after the surgery
When I woke up from the sedative after the surgery, the nurse walked me down the hall, and I had absolutely no pain whatsoever.
Now, I think this is important because I'm going to swing to your pictures from today, which shows that, you have quite significant bad back. You have problem in many different places, practically in your entire spine. And some of my colleagues say, either you fix everything or nothing at all. And obviously, in your situation, fixing them all would have been too much of the surgery. Now, what we did about a year ago, we did a fusion, minimal invasive fusion. And here, actually, we see that the bone is growing from one bone to another. So fusion both in the back and the front is complete. And we see as well that the bone is separated. That is what takes the pressure off the nerve. Now, you see as well you have problem above and below. You had a scoliosis of 17 degrees that is now has been reduced to 2.3 degree. And we didn't fix your entire back, but I guess this segmental correction did give you the relief you were looking for, didn't it?
Absolutely. It's just like it didn't exist anymore.
Excellent. Well, so some of my colleagues, I just came from a meeting, said that you cannot achieve this goal, especially the fusion, through an 8mm hole. And they said they tried it, they couldn't do it. And I was presenting my data that this is possible. And I invite them to come and look at my data. What would you say to somebody who said this is not possible?
Well, it's got to be possible because it happened.
Yes, and
the surgery was totally successful as far as I'm concerned, and that's I guess I'm the one that counts, really.
Excellent. Yeah, exactly. The patient's result, the improvement in the patient is actually what really counts. Your story, thanks God, is nothing unique because we are achieving this kind of goal for many of our patients, and so that is important to know that the segmental correction of the scoliosis with the minimal invasive technique actually works very well. And now, I think more importantly as well is that by reducing the risk of the surgery, we can achieve these goals pretty effectively. I'm going to swing to the surgical sheet here, which shows our surgery was done actually in 82 minutes, and our blood loss was about 200 cc, which is pretty high for OLLIF, but is even not 1/3 of an open surgery that would have been with the open surgery. So are you back to your basic daily activities?
Oh, absolutely, and I was almost immediately, really.
Yeah, you called me something just about
that. I after the surgery, I called you a wizard.
Excellent. Well,
and I had 9 little. What, 9mm did you say?
The 9mm, incision, multiple.
Yeah, in my back.
Yes.
With little, what do they call those strips?
The steri-strips.
Steri-strips on my back, and that was it.
Back. Yep.
Yeah.
Well, thank you for the interview.